Okay, so we are recording the call. You understand that, correct?
Okay. You can record,
So,
no problem.
so I'm Randy Bach. We have Kleber Luz.
Okay, thank you. And the first question is why Zika virus affected a lot of people here in Brazil, especially in northeast of the country and in the north at the Amazon basin, and affected children in Colombia, Panama, Peru, some cases in Bolivia, in Central America, and until Mexico. And after 2016, 2017, no more Zika congenital case was detected. This is the question. I think that's the most important question. What's happened? What I think about this? And the first fact, the explanation is that the Zika virus is closer to dengue virus. We have four serotypes, dengue serotypes, and sometimes the serotype 1 is not closer to serotype 2 or 3 or 4. Okay, it's probably why explain why the people develop 4 dengue infections during their life. And Zika is closer to this 4 serotype dengue virus. And so when the Zika virus arrived to Brazil, caused an important infection. And during the outbreak, if you can imagine during a tour in a tour about 12 hours in the pediatric clinic with emergency room where the pediatrician did the consultation for children infected by Zika virus. The pediatrician did 200 consultation during 12 hours. So almost all the people here become infected with the Zika virus. And it's important to understand that if you have 100 people that become infected with Zika virus, only 20% develop symptoms. So probably all the population, near to 100% of the population, become infected with Zika virus. Of course, just 20% develop symptoms, but we saw a lot of people infected. It's why no more Zika virus was detected after this outbreak, because all the people who was immunized against the Zika virus. Of course, we have about 10 years after this outbreak, and now we have a lot of children not immunized against the Zika virus. So I think that in the next year, we can probably will be in front of a new Zika outbreak. It's possible to be detected in the next decade or next years here in Brazil. Because at the 2015, 2014, there were a lot of mosquitoes in the cities. All the cities in Northeast had important Breton index. Do you know what is Breton index? It's an index that measures the amount of mosquitoes inside the houses. So the Breton index is very high, was very high at the 2014, 2015. So a lot of mosquitoes, a new virus, so probably almost 100% of the population was infected. And so Zika virus has just one serotype, so we do not have a new serotype to circulate here. It's the principal explanation why Zika go away and no more case. Sometimes now, we saw some patients with IgM reactive against Zika virus, but no molecular test positive for Zika virus. And how can we explain this? Because when the people become infected with Zika virus or dengue virus, in the next infection, the IgM test may be positive against. For example, if the people become infected with dengue and become infected with Zika virus 1 year, 2 years later, the IgM may be positive for dengue and Zika. It's why now we saw some patients with IgM reactive against Zika, but it's not Zika, it's dengue. It's dengue. This is the explanation, but no more PCR reactive for Zika virus here in Brazil that I know. But Brazil is a big country, and I don't know if you know the map of Brazil, the Brazilian map. At the center of the country in Goiás, I was informed that are some animals with a positive test for Zika virus, but no more human case. This is the explanation.
There's a lot to unpack there. So have you read either my article on the American Journal of Medicine or my book, Overturning Zika, or any of the other articles I might have sent you over the way?
No, not yet.
Are you familiar with what my thesis is?
Sorry?
Are you familiar with my thesis of why microcephaly disappeared?
No.
Okay. All right. So maybe we'll get to that in a little bit. I want to make best use of your time. I've read a fair amount of this, and I started with an article in 2020. Actually, 2019, I had written something up. I was kind of taken by the absence of any microcephaly after the, first year. I mean, it's not necessarily a calendar year between 2015 and 2016. There were reports of microcephaly, principally in Recife, Pernambuco, and Northeast Brazil, 2015. Prior to that, there had not been Zika in the Americas, as far as anybody knew, and it was found by Gubio Suarez Campos, if I get the name right, and his wife, Silvia, working out of Salvador, Bahia. And they had kind of a PCR reaction left over by, I believe, Senegalese researcher for some years prior, but it hadn't been, reasonably sourced or confirmed by Anvisa or anybody else within Brazil or CESAB. But they went ahead and did a ward in Camaçari, which is in the same province, I believe,
Yes.
of an industrial town. And they went through the wards, and I think they had pooled samples of people who had allergy or other some diffuse symptoms, and they came away concluding, after using the reaction they had on the shelf there, again without any provenance or confirmation, that there was indeed Zika in the Americas. There had been some talk about Zika, which heretofore had never caused any human illness in the decades prior. It was discovered from the Zika forest in Uganda. There's not much of a forest, actually. It's just really suburban Kampala. Another story. And it's, as you say, one of the dengue viruses. Guy Stephen Harrison here, MD, PhD. He calls it dengue. He calls Zika dengue 5 because there are four main strains of dengue. And since it's the World Cup right now, I'm sorry about Brazil, but since it's the World Cup, the interesting thing for me about these dengue viruses, they're flavivirus and they're icosahedral. So they're 20-sided pieces that are all shaped together, a little bit like some of the soccer balls back in the day when they had the that shape, that pentagon shape on the football. Anyway, so it's an icosahedral thing. It's not really distinguishable from dengue. But the part that interests me was that even before Zika was announced, there had been a group formed called CHIKV, the Mission, Chikungunya virus, the Mission. And the Mission, from what I understand, I read a book by Denora Denise, who's an attorney, advocate, and so forth. She did a compilation book on I forget the name of it, but basically kind of a hero tale of the heroism involved in the physicians and epidemiologists in Northeast Brazil in uncovering Zika and so forth, and working on what became known as Zika microcephaly, epidemic or pandemic or PHEIC, whatever you want to call it, of that, kind of plague year 2015-16. But the group CHIK-V, the mission, had been formed in 2014 on hunt for a new virus in northeast Brazil. And the hunt was named after chikungunya, also an African virus, heretofore never having been in the Americas. And from my understanding, and she did the interviews, I didn't, so I'm getting everything secondary notice, is that a certain group in Bahia and elsewhere in northeast Brazil wanted a virus, weirdly enough, to come to northeast Brazil because it's relatively poor. Again, Brazil's kind of like upside down from the United States. The north is hotter, more history of plantations, poorer, more Indios, dark skin, so forth. And there's a little bit of chip on the shoulder, if understand that expression, versus the south of Brazil, which is more like our north. So, you have Sao Paulo and Rio, we have Washington, D.C. and New York. And if you flip the United States upside down, you kind of get Brazil. So the north, northeast Brazil is, historically poorer, say New Orleans and whatnot. Anyway, so the idea was to bring attention and WHO money and whatnot, to the northeast Brazil with chikungunya there. So they're on the hunt looking for chikungunya and whatnot. And I think there was a little bit of veer in the road, like a little bit of a secondary pathway off that main road. And Suarez Campos, did this pooled sample. And again, there were no clinical studies per se, because Zika had never caused any human illnesses. In the 65 years of its existence, had never caused a single human symptom. You look in the literature, there's zero written about Zika causing human symptoms. And maybe it's for other primates, chimpanzees, maybe they get some illness. But dengue obviously is bone break fever. That's a very severe human illness. And again, there are 4 dengues. And again, mind you, as a side note, dengue has never caused any microcephaly. And there's probably 1 million or more cases of dengue every year in Brazil, and it's never caused any microcephaly or any other congenital abnormalities, to note. And none of the other flaviviruses, which hepatitis C, does like 500 million people every year or something like that, hundreds of millions, that never caused any congenital abnormalities. So none of the flaviviruses as a group amongst hepatitis C and dengue and the yellow fever and all these other flaviviruses, flava means yellow, never cause any congenital abnormalities, never cause any microcephaly. So this group had been formed for that purpose. So I'm just wondering, and Carlos Brito, my understanding, was in it. I thought you were in it from her reporting. I'm not trying to categorize this. Some other doctors. I'm wondering, what was that about? Is that an accurate accounting from her, Denise CHIK-V, the mission? And what happened with that group? What was the communication?
Okay. If I understand, your thesis is that why Zika never produced congenital disease, was never detected. This is the question.
Well, no, the question actually is more historical on a personal basis. What is she accurate? There was a group called Chikungunya virus, the mission. And mind you, the mission was a 1986 movie, Robert De Niro, Jeremy Irons, that took place in Paraguay about the colonials, the Guarani Indians, and the Jesuits, and so forth. I'm just wondering whether she's accurate. Was there a group, CHIK-V, the mission, WhatsApp group, so forth? Was that something that you were in, and were people hunting for chikungunya and then detoured to Zika?
Okay. So, remember that the chikungunya is an alpha virus. Is quite different from flavivirus.
Absolutely. No. So the question, I don't know if we're having a translation issue. What I'm asking is, I don't know if you know Denora Denise, and I could come up with the title of her book if I stop for a second. But she mentioned a group called CHIK-V, the mission, Chikungunya virus, the mission.
Okay.
Are you familiar with that group? Were you part of that group? Are you familiar with Carlos Britos or Gabio Suarez Campos? Were you communicating in 2014 and so forth privately, whether that was the name of the group or what? Were you communicating about finding chikungunya virus so that there would be attention to the problems of poverty and whatnot in northeast Brazil?
Yes.
So what's your recollection of that group? What was going on in that group? What was the hunt? What was the hunt like?
If I understand your question, are you questioning what's happened with that group?
Well, is she correct? Was there a group, chikungunya virus, the mission? Was there such a group?
No. If I remember, there was not a chikungunya group in 2014. The studies about the chikungunya at that moment was done by Rubio in Salvador, but we had a clinical investigation in Bahia, me and Carlos Brito. But no studies about the virus, different studies about the virus during that period. No.
Okay. I'll have to go reread her book and her passage because I don't remember exactly the characters. I thought she mentioned you as being part of that group in communication. Maybe she's, I didn't write her book. She wrote her book.
I was in the group. In Zika group because during the Zika outbreak, before the congenital disease, during the Zika outbreak in 2015, the Zika case, the clinical Zika case, becomes at the end of 2014, after the World Cup. And we saw a lot of patients with the low-grade fever, rash, pruritus, and joint pains. And about 30% of this patient had IgM positive for dengue. But no severe dengue case we saw during this period. So we formed a group, and I asked the Minister of Health that the minister has to look for Zika. It's why we formed a group, and I asked the people, the Minister of Health, to look for Zika. And I sent the samples from our patients from Natal to Dr. Cláudia Duarte in Fiocruz, in Paraná, to test for Zika. And the samples were negative, but 1 week after, she tested the new samples, and the samples were positive for Zika. But during the discussion in the group this group was investigating the rash exanthema disease, that was Zika. We asked the people to study Zika virus. It's why the people from Salvador tested the samples for Zika virus. And in Salvador, they informed the health authorities the isolation of Zika virus. It's what's happened. And after this, we continue to see a lot of patients with Zika virus. And about August, September, began the congenital disease of Zika virus. But this group is different from the chikungunya group. Do you understand? The chikungunya group was formed with some clinicians, me, Carlos Brito, a doctor from Salvador, not from Salvador, from Bahia, and we studied the chikungunya case, but the chikungunya case was other group.
Okay, so you're aware that there was some Chick v. the Mission group, but you weren't in that group.
Yes, I was in the chikungunya, but this group that I was part of, this group is just formed by clinicians. That's for clinicians to see the cases, to take the classes for other doctors, etc.
Yeah, no, I apologize. I didn't review her. I should probably have reviewed her book more closely before I spoke with you, so I apologize. but she goes on about that book. We could look at that later, who she said was in that group. But the interesting part for me was that the group was formed for a social purpose, in hopes that there would be a new virus in Northeast Brazil, so that it would bring attention to the poverty of Northeast Brazil. Does that sound fair?
No. The group that I was part, okay? I think that Denise is from Brazil. Am I correct?
I don't know where she is. I read the book. I've read it probably, parts of it I've read a couple times, 3 times, so forth. I sourced it and I look at it, but I don't know that much about her. I did send her a letter. I haven't heard back from her. I sent it a few years ago.
Yeah, she's not a doctor. She's
I think she's an attorney.
Yes. But she began to study the arbovirus after Zika congenital case, because she's, I don't know how to say in English, a pro-abortion. She's favored to abortion. She's favored to abortion.
Yeah.
And during the Zika virus, there were a fight between the Catholic Church and the people that is pro-abortion. And Denise is, how can I say in English? People that study the population, not a social worker.
Sociologist.
Yes. And she works with the woman rights, etc. But she's not a doctor. And if I remember, she begins to study the arbovirus just after the congenital Zika case. It's like now that we have an Oropouche virus here in Brazil, and there are some congenital Oropouche virus. It's like Zika, but it's not so frequent. It's a few cases of congenital Oropouche disease.
Okay, so I read that you were looking for a Zika, that Gubio Suarez, if I say his name, you say Rubio? I forgot. Anyway, I say, how would you say his name? Gubio Suarez Campos? Rubio?
Sorry?
The professor, I say Gubio Suarez Campos. Is that a correct pronunciation?
Yes, Rubio. Yes, okay.
Yeah. So the G's and the R's in Portuguese, we confuse them. So, like Recife, we would say, but it's Recife. And so I would say Gubio, we'd say Rubio Suarez Campos. Anyway, I guess he found it first, but you were also on the lookout at the same time, and you sent it to somebody, Claudia. You mentioned her name.
Claudia Duarte. Duarte.
Claudia Duarte. I remember that. So, so that was the discovery of Zika in, April 2014, April 2015, if I'm not mistaken.
Yeah, it's correct. But before this, during the meetings with the health authority from Brazilian Ministry of Health, I asked them to look for Zika virus. So the hypothesis that Zika virus was circulating in Brazil during 2015, the hypothesis was created by me. I informed, but I am a clinician. I'm a pediatrician too, and I do not work at lab, so I can't test the samples. So it's why we send the samples for Dr. Claudia Duarte in Curitiba, Paraná, at the south of the country.
Okay. And at first she said
the clinical hypothesis that the virus was present here was created before the confirmation by Dr. Rubio in Salvador.
Right. So I remember that part. And initially she said it was not, and then there were some other later samples that she said was, if I'm not mistaken.
Yeah.
So that was before any talk of microcephaly, and that happened later. So the way I've written up the story, and I recommend my book to everybody. I recommend it to you because it might be interesting. I have it in Portuguese, sold in Brazil, and it's called Overturning Zika. and I always get the word wrong in Portuguese, but it's basically deconstructing, desconstruindo o Zika. It has not sold widely, but I think it's an interesting read for a couple different reasons. But so the discovery part was, you don't really have spring there. It's April, what we call spring, but April 2015, you're not really seasonal on the tropics. And it was not until like August of 2015, and totally unrelated, that the various members of the van der Linden family in Recife were neuropediatricians. I think there's Vanessa van der Linden Mota and her mother, Anna van der Linden. And there's a brother, she has a brother, or Anna has a son, Vanessa's brother, Elio, is also a neuropediatrician. And I guess the dad was the late father as well, centered in Recife. And in the wards, based on Recife, the catchment population is about 2.5 million people for that area, and everything kind of funnels into the central neuropediatric ward. Ordinarily, based on the criteria that were around at the time of what was determining microcephaly, it's kind of a measurement diagnosis, like saying who's tall and who's short. If I go to Japan, I'm tall. If I go, in front of a basketball team, I'm short. So it depends on the background criteria. I have some short friends here. If they go to Japan, they're all of a sudden not short anymore. So a lot of these things are contextual. The grading for determining microcephaly in Brazil at the time was 2 standard deviations from the mean.
Yes.
So anything less than 2 standard deviations. Now, that was not the Euro standard or the WHO standard for microcephaly, which is 3 standard deviations. That's 17 times rarer, more rare, to be microcephalic on the world metric versus the Brazilian one. So at the time, Brazil had a metric that was 17 times too lax, too easy for making that diagnosis. Nonetheless, using their own criteria based on the population, number of births, so forth, I calculated that there should be about 6 or 7 or 8 babies deemed microcephalic in Recife at any given day, Monday, Tuesday, Wednesday, whatever day of the week, there should be that number. But at the time, I think they noticed probably about 15 to 16 cases in the wards at one moment. So they had their own WhatsApp group, and people were communicating what's going on with this. Why are we seeing so many? Now, in the realm of statistics, having 2x an amount, we have snow here. You probably don't get snow. Some years, like this year, last year, it snowed like 3 times more than a normal year. That doesn't mean the world is diseased. That means it just snowed more. Some years there's like 0 snow. So there's some variance in what we might see. There's not like a standard number that has to be 6 cases every day of the week. Sometimes you might have 0, sometimes you might have 12, so forth, some variance. And so at this point, they didn't have any background registry of microcephalic numbers anywhere in Brazil. They weren't keeping track of the background data of, in order to see how, now mind you, getting back to snow, we keep track of every year how much snow there is by day, by year, by city, by place, by town, by country. So we keep track of snow numbers. We keep track of lots of stuff, rainfall, whatever. There's a lot of data for a lot of things. But microcephaly was not something that was kept as a data point anywhere back historically for Northeast Brazil or Brazil in general. So there were some standards of what it should be, but mind you, the standard was wrong, 17 times wrong, by a factor of 17. But nonetheless, using that number 17, there were maybe about 15, 16, 17 cases in the ward in August. And so there was a bit of a call that this was an unusual thing. And my understanding is Carlos Brito, who had been part of the Chick v. the Mission group and maybe your Zika group, whatever, and aware that there was a new virus in Brazil, my understanding, and I'm reading the Nora Denise book, I've sent letters to Carlos Brito. I received one back, but I asked him to communicate like this. But my understanding is because he was in Recife, he was aware of Zika from this other communication. He said, Zika is new, microcephaly is new, maybe they're connected. Maybe this new thing and that new thing, they're connected. So he went to the mothers who had given birth to the microcephalic, the babies deemed microcephalic, and he went on the phone and he found 30 or so of those mothers, and he telephoned them one by one. And he said, did you have any fever, rash, or chills during pregnancy? Because mind you, there were no Zika tests on Earth clinically anywhere, because Zika, as I said before, had never caused a single human illness. So he telephoned people, and mind you, I think everything's kind of skews towards poverty. So he's talking more to poorer, less educated people in general, because that seems to be where the mosquitoes happen more than in the wealthier parts. Maybe more mosquito netting, whatever, in the favelas and so forth. Anyway, when he got a response, I think 20-something of the women said, yes, I had fever, rash, or chills during pregnancy. He checked the box. That was Zika. And he made a determination post hoc without doing any blood tests that because the Zika was new, microcephaly was new, they had fever, rash, or chills. Again, no examination, no Zika testing of the mothers. He said Zika causes this microcephaly. And he kept the information to himself. And one of the local authorities in Recife, I guess he showed the information to, and they were like, whoa, hold on this. Don't announce this just yet. We should do some peer review, and we should do some bigger studies. And that didn't happen. And they were going to have a meeting in one of the main hospitals in Recife, and he called the meeting off and went to the press in October of 2015 and announced to the press that Zika was new and it was causing microcephaly. And then it opened kind of Pandora's box. It opened a kind of a pandemic hysteria, getting Pandora pandemic, and just everything went wild after that. So there was kind of an exaggeration of people looking for this. So they went out looking for cases of microcephaly, and there was a huge bloat of number of extra cases. People were erring, that is, they were making a mistake. They would rather mistake for caution. So they did overdiagnosis of babies, so they might get the attention to be microcephaly. So and mind you, it started in Recife, and then it wound up pretty much concentrating in the northeast of Brazil, this overdiagnosis number. So when you look at the actual numbers, it doesn't, the Zika map doesn't map with the dengue map. It's the same mosquito. It's Aedes aegypti, which mind you is also from Africa originally, aegypti. But the Aedes causes, carries the dengue and doesn't know which one is carrying. It carries the Zika exactly the same. But the mapping of where people get dengue historically is not the mapping of where the Zika outbreak occurred. It's not in historical Aedes aegypti areas. It's not an historical dengue area. The map is not coincident. There was lots of jungle in Brazil, but this tended to occur in urban areas in northeast Brazil. That's where the big numbers of supposed Zika cases, mind you, with no clinical testing, and the big numbers of the microcephaly occurred, mostly, in my view, from word of mouth, from a kind of a rolling hysteria over the diagnosis. Now, nobody wants to have a baby with microcephaly. Now, microcephaly per se is not an illness. It's a classification. Again, it's like saying somebody's short. Somebody short is not a disease. You can be short. You can be tall. It doesn't mean a disease. Okay. So it was a classification. Now, it was only until like January of 2016 that Brazil announced that they were going to conform to the new, well, frankly, the existing correct Euro standard of 3 standard deviations to even say whether something is microcephaly. Then the number started to drop. Once they had the correct, mind you, 17 times more strict classification for microcephaly. And microcephaly is also not an intellectual illness per se. It coincides with intellectual disability, but it's not pathognomonic per se. And microcephaly has been around forever and has many, many different causes. There's one genetic one, which is rare, called true microcephaly. It's 1 in 10,000 births, no matter what. And there's nothing to do about that. But the other case of microcephaly, nobody really knows what it is, but it's associated with the torches, the toxoplasmosis, rubella, cytomegalovirus, herpes, syphilis. If I'm missing any, I apologize. Anyway, it's associated with some infectious disease, associated with alcoholism, associated with malnutrition. A lot of these things correlate with poverty. And what we saw in Recife is not in the center. If you look at the cases of microcephaly, it was all on the periphery where the poorer neighborhoods are. In the United States, a lot of people poor live in the city. In Brazil, it's the poor people live more on the near outskirts, and the wealthy live in the city, central. So what these things correlated with is poverty in a sense, and even these Zika cases correlated with the poverty areas, but it didn't correlate with the mosquito belt. If you want to look at the mosquito belt, it's really further west and so forth in the Amazonian basin and whatnot. I know the population is lower there, but there's huge swaths where people do get dengue on a regular basis. Like the million announced cases every year. As you were talking about, there might be extra cases that people don't have clinically. So that, but the areas where you have dengue did not overlap with the areas where supposedly people claimed Zika. And mind you, they claimed it without any clinical testing at all, because there was literally no Zika test to be had on a clinical basis for any of the doctors who announced the cases of Zika microcephaly. So that's kind of where I come at this. And my own personal feeling, you didn't ask me, but my own personal feeling about this is that Zika is a real virus, and microcephaly is obviously a real condition that pre-exists our announcement of Zika. They just don't happen to have anything to do with each other, because like dengue has never caused a single case of microcephaly, and I don't think Zika, if it were doing all this, whether it's confused, mind you, conflated with dengue is another story. It could just have been whenever you do nowadays, when you do a Zika test, it coincides with a dengue test. It's impossible to distinguish them.
Okay, let me tell you a brief history in my experience with congenital Zika disease. Okay, we had a Zika clinical outbreak here, and the first question that you did is why the children doesn't have a confirmed test for Zika virus. The answer is because we do not have. We did not have the tests, the test for tests the children to do in the children. This is it's what's happened with the all other Zika cases in northeast of Brazil. We do not have tests, just a molecular test that was synthesized in French, in Institut Pasteur. I think that Institut Pasteur from Senegal, from Dakar. So Dr. Claudia asked Institut Pasteur from Dakar to send the test to Curitiba, and she used this test to test our samples for Zika. So distinguished from dengue, we do not have serology. At this year, we didn't have serology to test for Zika virus, only molecular tests. And if you know, the viral load in Zika infectious disease is not so high like chikungunya. It's low. You have to test the people during the first 3 days of the disease. If you test in the day 4, day 5, or day 6, the test probably will be negative, because the viral load is so, it's not high like the Zika or dengue. So it's more easy to test for chikungunya, it's more easy to test for yellow fever, it's more easy to test for dengue, because the viral load is high. But in Zika virus is low viral load. This is the first explanation why the majority of people with Zika virus during the outbreak in 2015, 2014 were not tested for Zika virus, because we do not have this test. Okay? And I will tell you a brief history that what's happened with the congenital disease. In about the May, June 2015, a woman, a Brazilian woman, lived in Italy and come to Natal to do a postgraduate course. And during, it's not a poor people, it's a rich people. And she studied here in the postgraduate course and became infected with Zika virus. But she was pregnant and go back to Italy about May 2015. And in Italy, the doctors detected a congenital disease. The people from Italy looked for Torch disease, and all the tests was negative. And she called me, Dr. Luz, because I did a consultation during the Zika clinical manifestation disease here in Natal. And she called me about the May, June 2015, and asked me, Dr. Luz, please, Zika virus may be the cause of congenital disease? And I answered to her, no, it's impossible. It's impossible to be done by Zika virus. Your children develop a congenital disease caused by other disease. And she told me, please, doctor, all the doctors here in Italy studied, and all the tests for congenital disease was negative. But when I was asked, first time in my life, about congenital disease caused by Zika virus, my answer was no, it's impossible. It's something like your opinion now. But this baby was studied for Zika virus in Europe. And the test for Zika virus in this baby was positive. This case was published in New England Journal of Medicine. You can recover this paper in the New England Journal of Medicine. And about August, Carlos Brito called me. We had a very high communication, me and Carlos Brito, about Zika, and asked me, if I remember, if I am correct, he called me in a Monday day and asked me, Kleber, are you seeing microcephaly in your city? And I said, no microcephaly disease here. But I will look for. And in the next 2 days, I went to hospitals, we call in Portuguese maternidades. You understand? Maternidades. And look for microcephaly. And I call the neonatologist for a meeting in the Friday of the same week. Because in the Friday at my university, we had a meeting with other doctors, the students, the residents, etc. And I call the health authorities in my city and the neonatologists. If you know, neonatologists is a very high occupied doctors. They work a lot. They work at the maternidades, hospitals. They work all the day. And I asked them about the microcephaly. And all the neonatologists that I call informed that they are seeing a lot of microcephaly patients in the maternidades. And I invited them to go to this meeting. 5 days after Carlos Brito called me. And during this meeting, there was a lot of neonatologists. And all of them informed during this meeting that the number of microcephaly case is so high, is quite different from the previous experience. In this group of neonatologists, there were a practice medical, professor of university, a lot of doctors. And the personnel from epidemiological center here in Rio Grande do Norte, where I live, informed about the congenital disease. We have a following, like you in your country, about the snow. We have congenital diseases informed for the health authorities. And here in Rio Grande do Norte, we have just 5 microcephalids by year. This is our historical data. During a lot of years, we have just 5 microcephaly disease detected during a year. And during this meeting, the person from the epidemiological center said, I remember clear the phrase that the people said for me, Dr. Luz, you are crazy. It's not happened in our state. And during these words, the neonatologists, all of them say, it's not possible because we are seeing a lot of microcephaly. In a small hospital here in Natal, during a weekend, 5 children were born with microcephaly. with no microcephaly definition by the Minister of Health. The microcephaly was defined by the neonatologists. And I began to receive the photos from these babies. 5 babies during a Saturday, 5 babies during a Sunday. Of course, if you ask about the microcephaly, was more important in Recife because my city is about 700,000 people, and Recife is about 2.5 million people, so it's bigger. And Recife is a poor city, but Natal is not. Here, of course, we are in Brazil, Northwest Brazil, we have poor people, but our population is not so poor like in Recife. So the microcephaly that we found here was not directly related to poor people because the hospital where the newborns born in was located in rich region of the city. And poor people and rich people had microcephaly babies. What may happen? The rich people had access to ultrasonography. And probably if the ultrasonographists detected microcephaly, I don't know what happened with this child. Of course, abortion is prohibited here, but we know that the woman may do abortion here in Brazil, a clandestine abortion clinic. So we saw children with microcephaly, poor and rich. Of course, we have more people that use the public service, but was quite different. And after this month of August, September, October, November, December, the microcephaly disappeared because the pregnant woman became infected in the first semester of 2015 and had the parto in the second half of 2015. And I did an interview, not a phone call, a direct interview with the pregnant woman, and asked about the clinical disease, the fever, the rash, joint pains, etc. And all of them informed me that had Zika. And I work in a hospital that we have a obituarium, I don't know how to say in English. A part of this hospital had a necropsy system. Do you understand? Necropsy?
Yeah, a mortuary, like autopsies.
Autopsy service, okay? So at the service, I went there, and the pregnant woman who lost the baby was born not just with microcephaly, but microcephaly, cardiac defects, arthrogryposis, a lot of other defects. Microcephaly was the most important, the most significant of the Zika congenital disease. But the Zika congenital disease has a lot of other clinical signs, like arthrogryposis, etc., etc., etc. And during the autopsy, I recovered the brain tissue from this baby and sent to Atlanta, to CDC in Atlanta. Are you based in the US?
Yes.
Okay,
yes.
To Atlanta. And before the announcement of the Zika microcephaly outbreak, I received the answer from CDC. Dr. I don't remember the name of the doctor now. And she tested for Zika virus. And the tissue from this baby who was died caused by new disease was tested positive for Zika virus in the blend, in the placenta, etc. The same samples I sent to Claudia Duarte that detected the Zika virus in the blood from the people infected with Zika, tested these samples, tissue samples, for Zika and was positive. I take the brain of this child, divided in 2 parts, send one part for CDC, other part to Claudia Duarte, and the result was the same. The virus was detected, and no other virus was detected. So, of course, Zika caused microcephaly.
Well,
This is
that's not cause. In order to determine cause, I mean that can be coincidence. Many things can happen collinear. That one thing happens, another thing happens, doesn't mean those things are related.
Okay. Let me explain to you. Are you a physician?
Yes.
Okay. So, in infectious disease, when we did a diagnosis, if it's not Zika, we have to have other diagnosis. Oh, this is a suspected dengue case. No, it's not dengue. So what's happened? Chikungunya. No chikungunya, Oropushi. But we look for the other disease, and all the other diseases were negative.
Well, that's not true with microcephaly. I mean, it might be true if you have a lung cancer. Okay, with a lung cancer, you can get a tissue diagnosis. So it could be oat cell, it could be small cell, it could be, not that it's cancer, but might be asbestos related, might be mesothelioma. Anyway, there's lots of different things. Something could be. It could be a lymphoma, whatever. We get a tissue diagnosis for a lung cancer.
Yes.
Microcephaly is a qualification. And again, it's a quantification as well that was using the wrong standard. Once the 17 times stricter standard came into being in January.
But it was not just microcephaly. Not just microcephaly.
No, I understand.
When we did a magnetic resonance or a scan from this baby, we found calcification, ventriculomegaly, a lot of other diseases, not just a microcephaly.
Well,
microcephaly is a trial. It's a trial.
But now you're kind of changing the map a little bit. I mostly try to stick with microcephaly because it's something that was the term Zika microcephaly. You're going to find weird, strange anomaly cases, but having after the fact, post hoc, finding a Zika virus, or you could find some other virus, toxoplasmosis, whatever, does not imply causation, because there's going to be some virus extant in the population anyway. It can be something that happens with something, not because of something. In one case, you can't make determinations on a population basis anyway. What happened from this is that, in my view, Rubio Suarez Campos, when he announced in April 2015 that Zika was around, he did this study in Camassari, and he had pooled blood on a special reaction agent from Senegal as well that had not been tested anywhere else. And he did PCR testing. I'm not sure how many phases and whatnot. And he did pooled blood samples and I don't know. He made a determination that something heretofore that had never been a human illness was causing human illness. But he didn't do it through peer review. He didn't have his own analysis tested by anybody else, anywhere else. And over time, he announced it to the press. He went to O Globo and announced it. And I mind you, it became a news story. It was on TV. It was in the papers and all that kind of stuff, online and whatnot, that this was an announcement. He said, the wife said, oh my God, we go, wherever we go now, we are, we're widely noticed. It was very widely spread. So if they became celebrities of a sort, because they announced Zika was in the population, he was asked specifically, well, what does this Zika thing do? He says, well, it's kind of like, maybe a mild version of dengue, whatever. What do we do about it? What's the treatment? He says paracetamol, which is Tylenol, acetaminophen, we call it here. So basically nothing. There's nothing to do about it. You're going to have a few days, it goes away. So the question for my mind is, why did he bother to announce this kind of nothing diagnosis to the public rather than having to go through peer review? He's a research, PhD, from my understanding, and so is his wife. This is what they do for a living. I see there was some celebrity status achieved. I'm not saying he did it because of that. If you look at his Instagram now, he says, Descubridor de Zika in the Americas. He's the discoverer of Zika in the Americas. He wound up getting a job in Buenos Aires, which I gather is a little bit more prestigious than Salvador. I can't judge that. I have no idea. But he, for his own, personally, you could watch his face on Instagram, and that's what it says, discoverer of Zika. So he something attended to him. It's like, if I find a new crater on the moon, I name it the Bach crater. I have some notoriety, some fame, whatever. This seems to be like a silly thing to do, to announce something that's immaterial. It's not a human illness to the world, whatever. It just inflames people, irritates people, excites people for no reason. There's nothing. It's not a distinction without a difference. It's not going to change anybody's lives. But it did implant the word Zika in the populace. And so this other thing came along, which again was not peer reviewed, was not tested. There was no backwards registry. There was a doctor, I can't remember her name, a year or two later, I think in 2017, she was in Paraíba. You can tell me what province that is, what state that is, but in Paraíba, she did the first type of a reformation of a registry. So she went back to the public health hospitals, which, mind you, is case selection because there's public hospitals which are poorer people probably, but that's what she had at hand. And she went back and marked down the size of the heads of the babies because they had been measured. They just hadn't been put into a spreadsheet nationwide or for any public health services. There was no public registry or private or clinical registry of microcephaly. But she went back and looked at the prior years and then looked at 2015, 2016, 2017. And she found when you actually did the correct standard, the 3 standard deviation measurement for babies with heads, that she found there was no real increase anywhere in Paraíba in the plague years of 2015 or 16. There was no increase. There was no gross increase. Now she parsed this out to moderate microcephaly and severe microcephaly, and for one of those there was a tiny little blip, the severe, whatever, but nothing. There was not markedly and statistically significant change in the baseline level of microcephaly. So what you have here is kind of reverberation. You have people vocalizing a problem, announcing it. Everyone starts to look for it. If I suddenly, announced in my local newspaper that we have, I don't know, cobra snakes, whatever, everybody started looking for snakes. Every time they see a snake, they think it's a cobra snake. And they wind up hitting it, and they feel better about themselves. It turns out that there's no cobra snakes. The people are banging garter snakes here, and it wasn't really a thing. But that's the way human nature goes. If you look at, again, my book, it goes in this more, but it's in the American Journal of Medicine also. But if you look at the book, you'll find diagrams that show where the cases were announced. Like I said before, it was not coincident with dengue. It was not coincident with the mosquito. And we only postulate that people get Zika from the mosquito, but it's not in the mosquito belt. It didn't coincide where people get dengue and so forth. But I don't want to get too far down that road. But the second problem I see is when Carlos Britos did this, in my view, non-scientific. It's biased by selection bias. He called up only women who had this kind of baby. It's got authority bias because he's calling from the big hospital. He's a doctor. He's calling poor women. He's saying whatever. And it's also potential other kind of biases because they might think they're going to get something from this if there's a fund available. And now, mind you, they did make a fund available for babies, mothers with babies with microcephaly. But again, during this time, it was the wrong standard for microcephaly. But be that as it may, whatever findings he had, let's say it's all valid. Let's stipulate that this did happen, that there was an increase, whatever. But even if there were any, mind you, increase on the wrong standard, but let's say it was increase on the right standard, the WHO and European standard. Let's say there was severe microcephaly happening. It would seem to me to behoove him to run it by the hospitals and so forth, and to announce it to the nationwide, surveillance team, because he's one man. I'm one man. You're one man. And we have our, things we see ourselves. But if you want to announce a calamity to the world, if I announce the cobra snake, I should get a picture of it. I should have people corroborate it. I should find some other cobra snakes before I announce it. Everyone starts panicking about snakes or whatever it happens to be. But in this case, he was going to have a meeting that weekend in October, and for whatever reason, he called it off, and they didn't. I don't know exactly what happens. I'm only reading it from the book, from Denota Denise's book. And mind you, she sees him as a hero. I personally have not met him. I can't comment and so forth, but I do know it's not ordinary to have that kind of information for 2 months, from August till October, and then not give it to other people to confirm. And mind you, again, because there was no Zika testing, and all he did was telephone after the fact, again, multiple levels of scientific bias there. That would not pass any kind of, randomized clinical double-blinded study and so forth. And the exigency of the situation, because again, Zika had never caused human illness, dengue had never caused any congenital. Like you said, your initial suspicions was this would be impossible. Well, you're right. You're right. It is impossible because it's impossible. And if it's possible, then you have to prove it. I can't stipulate that, the cobra snake's in there unless I can prove it. It's not enough for me to stipulate it and say it and announce it and get everyone inflamed about it. I have to really, the burden is on the one who announces the hysteria. And we have an expression here: you can't yell fire in a crowded theater. I'm sure you have a similar kind of expression. You can do it. Anybody can do it. But what happens is that people are very attenuated towards fear. We saw this during COVID. We have a brain that's, I don't know, this big. A good part of our motivation of brain is to avoid danger. Okay? Because that's very productive. You can miss, 1,000 beautiful sunsets. You can miss, seeing bunny rabbits or whatever. You can miss a lot of wonderful things, flowers. But if you miss one predator, you're dead. So we're supposed to be fearful. Every animal is supposed to be more fearful than tame. And so if you have something that's going to generate that much fear, it behooves you to have other people corroborate it. Insofar as there were some other people in Recife who were willing to look at this, he jumped the gun and he announced to the press. So even if he's right, let's stipulate he's absolutely 100% right, which I don't. But if you stipulate he's right, he did it the wrong way, just like Rubio Suarez Campos did it the wrong way by announcing to the world rather than going through any scientific channels in the first place. When you have things like announcing a poisonous snake, you have to. It's the burden is on you to prove it before you announce it. You can't announce it and then let everything follow. You can't yell fire in the crowded theater unless there's a real fire, or you're crazy. You can't do that, and it's not helpful to everybody else after the fact. And so when the dust settled, again, the data are there. When the dust settled in Paraíba, I don't know about all of Brazil, but the woman who did the study, I think her name is, I'm going to probably mispronounce it anyway, but you can find the study in my book. When she looked at that, they looked at the data, she didn't find any increase in the bad years, 2015, 2016, of microcephaly. Now, mind you, there are other places. Once this was announced in 2017, 2018, the world started to develop some Zika testing, okay? Because the world moves, right? There was no COVID testing when they announced coronavirus, that particular kind of, SARS-CoV-2, when they announced it, there was no test for that. It was a while before the testing caught up. But we live in a modern world. People can conjure things up. So within a year or two, there was Zika testing. So in Rajasthan, India, they were doing testing, and they found, and it's tropical, and mind you, there's two kinds of Zika. I don't want, Zika 1, whatever, two kinds of Zika. I think an Asian Zika and whatever, African Zika, but whatever it happens to be. They were ready for the microcephaly. So they found they had Zika testing, and they were doing it clinically. And they said, oh my God, we're going to see microcephaly. So Rajasthan in 2018, I believe, they announced a Zika outbreak, and they wanted, women to be careful. But before they announced it, there were presumably Zika going around, mosquitoes and whatnot. And they waited. Nothing happened. No microcephaly increase anywhere on Earth ever again. And all the other places, now mind you, even in the what I call the plague year, the 2015, 2016, that window of opportunity, the mosquito doesn't know borders. The mosquito doesn't know if he's biting a pig in Colombia, Venezuela, Brazil, Guyana, whatever. The mosquito doesn't know this, right? If you look at the actual rate when they did testing of Zika, if you look at the microcephaly rate, it was vastly higher. Dozens of times, I think 30, 40 times higher in northeast Brazil than it was in western Brazil. It was higher in Brazil in general than it was in Colombia, Venezuela, or anybody else, Peru, so forth. All through the Caribbean, when there were cases of Zika, the microcephaly never showed up that year. Now, this is being stipulated. If you say it's, sometime later, immunity grew, well, that's fine. But in that first year, which everyone's virgin, everyone's naive to the same Zika virus is showing up all of a sudden. In Colombia, no microcephaly. Venezuela, which has its own weird government, they kind of like, a little bit more Stalinist at the time under Maduro and whatnot, so maybe information doesn't get out. But any of the other countries, you go through all the Caribbean and whatnot, there was no increase in microcephaly. And mind you, if you go back to Recife, which is in my view kind of ground zero for this problem, you go back 2017, no microcephaly anywhere through Brazil. And again, once the dust settled, once they recalibrated using the correct metric, and then the hysteria went away, there was no microcephaly. And there's no reason to think that all of a sudden everyone became immune to this single Zika strain, where they don't become immune to dengue on a regular basis. There are 4 dengue strains, so they're gonna rotate like the influenza. They're gonna go maybe dengue 1, dengue 3, dengue 2, dengue 4, back to 1. I don't know. Again, I'm not the mosquito. I'm not the people getting dengue, so forth. But there's some rotation going on. But every year there is dengue. It never stops. And every year, again, like 100, 600,000, a million cases in Brazil every year of dengue. And that's just the cases. There's probably 5-10 times more dengue, but no microcephaly from dengue. And if you look at the soccer ball of dengue and the soccer ball of Zika, same thing. It's the same virus basically. And somehow 1 million cases or more of dengue, no microcephaly through decades.
No. Please. It's Zika virus is closer to dengue virus, but the clinical manifestation is so different.
Yeah.
If you see a dengue cases, the patient may develop shock, etc., etc. Zika, no shock. It's why we thought that the people was infected by Zika virus, because we had a lot of people sick with fever, rash, IgM reactive for dengue, and no death. It's why it's quite different. It's not the same. True. The number of Guillain-Barré syndrome increased. We have 3 in our region.
Did you say Guillain-Barré?
Guillain-Barré. Yeah. Guillain-Barré cases by month. A historical for 25 years. 25 years. The same number, 3 cases of Guillain-Barré syndrome here in Natal. During the Zika outbreak, for 12, 15 cases. So Zika is close, the virus is closer to dengue, but the clinical picture, the neurological manifestation is quite different. It's not the same.
Well, so stipulant.
So after this, and more, I think for in Feira de Santana, a city closer to Salvador, it's important to talk with the doctors in Feira de Santana and ask about the microcephaly there. You have the information from Recife, because Recife received a lot of researchers, a lot of money to study microcephaly caused by Zika. But Zika, microcephaly, and congenital disease caused by Zika virus was present in a lot of cities in northeast of the country. Right. Talk with the people from Feira de Santana, the doctor from Natal, from Paraíba. We have a lot. Of course, there are some doctors, like in COVID, that said that the Zika was not causing this. This was a vaccine, etc., etc., etc. And if you talk with the people from Polynesia, French Polynesia, before the Brazilian outbreak of Zika, Zika produced an outbreak in Polynesia. Talk with them and ask about...
It didn't produce microcephaly. I've researched this.
Do you know why? Because the abortion is permitted. If the children has a malformation...
But they wouldn't have known that. They wouldn't have known, because this is kind of like backwards in time. This is dramatic irony. You know, you're talking about, I think, 2007 or something like that. And there were, you know, I've researched this a fair amount. I don't want to like relitigate that case per se, but there was no microcephaly. And if you're saying they're aborting in advance of something that would cause microcephaly before there'd been an association in 2015 of Zika with microcephaly, that seems to be counterfactual. It doesn't seem like they would have that knowledge to go abort all the time. And I think it's a big decision to make, so forth, for people who are not going to abort and whatnot. And you're talking about population-wide abortion. I don't think that's adequate. You know, the fact of the matter is that dengue doesn't cause a long-lasting immunity. That's why there are 4 strains, and the fact that there are dengue 4 strains, you know, means they're probably rotating every 4 years. Okay, there are 4 strains, and people are getting dengue every year. There's no 0 dengue years. It's over and over and over again. So the fact of the matter is, it maybe takes 1 year, 2 years, 3 years, something in that. Because you have 4, they're going to come out randomly. It's not like it goes 1, 2, 3, 4, like is written in a book. It probably goes 1 and 2, maybe go back to 1 again, maybe 3. So there may be a year or 2 where you're not going to get the same strain. So, you know, Zika, by all intents and purposes, should have a similar pattern. And mind you, there are 2 basic strains of Zika, but they're geographic. They're not the same coincidentally local. There's the Asia strain, there's the Africa strain. You're talking about the Africa strain in Brazil. So maybe you'd have 1 or 2 years of coverage like the dengue, maybe 3 years or whatever. So you should have seen cycles of Zika recurring, and they didn't. And mind you, where Zika showed up, like I said, in virgin territories, naive populations, there was no microcephaly ever again. And so, mind you, you know, I'm checking my watch here. It's 2026. You're talking about 11 years later. You know, there's been no increase in microcephaly ever since anywhere on Earth. And again, even in that plague year, there was no increase in microcephaly in Colombia. Now, mind you, they saw cases and so forth. So what you're talking about is kind of the perfect storm of the wrong standard for microcephaly 17 times. I don't have enough fingers, but 17 times too high. Boom, boom, boom. 17 times too high. So you're getting 17 times the cases you should. That's 17 times overdiagnosis, mixed in with the hysteria factor, whatnot, mixed in with the fact that Zika was no testing, mixed in with the fact that nobody confirmed these things by peer review, either the Zika discovery in April by Rubio Suarez Campos or the announcement of the connection by Carlos Brito in later in 2015, October 2015. No confirmation of any of those things simultaneously. And the fact, mind you, it's a sad, horrible, tragic thing when you see a case of microcephaly. I don't want to see cases of microcephaly. I don't want anyone to have it. But at the time, the predictions were based on that template that they had, that there would be 1 million, I don't have enough fingers for that, 1 million cases every year around the world extra of microcephaly. The number we have had since then is 0. But we have had 1 million of something. What we've had practically in Brazil is 1 million fewer babies being born. I call them ghost babies. Because what has happened is that women naturally got skittish. They got a little bit scared about having a baby in those certain areas. And so I was reading an article about Salvador recently, and the population numbers are kind of going down. The school attendance, there are fewer kids in the school, and people are like, what happened? It's like, well, women don't, the birth rate went down. Maybe this was the ideal, as you were talking about abortion before, not just the abortion part, but a lot of the WHO people who came in and they wanted birth moratoria. I don't know if you know what moratorium, they wanted a birth moratorium. That is no pregnancy. They WHO aligned physicians came to all throughout Latin America and Brazil, and certain states within Brazil, they announced, they said, please don't have any babies at all until we can have a Zika vaccine. Now, again, checking my watch, 10 years later, there's no Zika vaccine. If everybody had listened, there'd be 0 babies in Brazil, Honduras, El Salvador, Colombia, Dominican Republic, you name it. There'd be no babies anywhere. But what has happened is there's at least 500,000, probably close to 1 million children right now who are not children. They never were born because the parents got scared out of their minds about having the babies. Now, I think this is, literally it's not productive because they didn't produce the babies. It's not reproductive. It's not productive or reproductive. And the fact of the matter is, if this thing was the thing that people said it was, they should have announced it and to authorities first so they could be checked and they could do the testing and all that kind of stuff. But that did not happen, like I said. So I personally see this as a great sadness. And the fact that it has never occurred in virgin areas outside of Northeast Brazil at that time, and the fact that it's never recurred, even though dengue, again, recurs probably every 2 to 3 years based on the same strain, all the excuses that people come up with seem to be what we call CYA, which means cover your butt. They're excuses after the fact. But if you look at it from a prospective, not a retrospective viewpoint, and let's say we just, we could watch this whole movie again. Okay, so I watched some movies, not that many. I watched The Fugitive. I don't know if you know The Fugitive. I've watched that movie 5 times. Every time I watch the movie, the same thing happens. And if I were going to watch The Mission, the 1986 The Mission, the same thing would happen every time I watch the movie. So let's say we had watched this movie again, but now we've already seen the movie, and we know the fact that nothing happened in the next 10 years. We'd watch that movie with a different suspicion about who the criminal is. Here, and I don't want to use the word criminal, that's a bad term. I think everyone has good intentions, but we'd have a different assessment of what actually happened. This assignment that Zika existed was unfounded. And the assignment that there was gross microcephaly was basically unfounded. There might have been some, there might have been some increase, like you're saying, and it's a tremendous sadness when you see a single case. So it gets at people's heartstrings. But the fact of the matter is that the actual increase on a gross population level, not a single case, but a gross population level, is unfounded. Now, Vanessa van der Linden Mota, the neuropediatrician who's gotten some fame for being the one in Recife who announced the connection, although it was really Carlos Brito, but she's taken some of the credit for this. She said, it's in the Wall Street Journal in 2016, and this is the thing that actually started my curiosity about Zika in 2016. I let it disappear for 3 years because it's not my problem. And only Facebook, like 3 years later, I had made a post. I said, I think this thing's going to not really be all that big. Something like that. Facebook, 3 years later, they said, oh, what about this post? I just have, well, what did happen? It's 2019 now. If I look back, there should have been lots and lots more microcephaly. It disappeared. So I'm like, am I the only person curious about this on Earth? Apparently I am. So I started researching. I've done a fair amount of work on this, as you can see. But the article in the Wall Street Journal by Vanessa van der Linden, well, it was about her. In the Wall Street Journal, she said, I saw a pair of twins, okay, both boys, but fraternal twins. They were not genetically the same. They were not identical twins. And when these babies came out, one baby had microcephaly and the other was completely normal. So I said to myself, and you can read the quote, okay? I'm not making this quote up. I might be getting a little bit wrong. I'm not word for word. But what she said, when I saw the one baby with microcephaly and the other baby who's normal, I said to myself, this has to be an infectious disease. And I remember reading that. I read it like 3 times. I'm like, why? Why does it have to be an infectious disease? I mean, they're different children. They're in the same womb at the same time. But if it was an infectious disease, I would think that, you know, we call one João, we all call the other one Federico. I would imagine they both have it. If it's infection, you know, you don't get sick in half your body. When I get the flu, it's not the left half of me gets sick, the right half of me is fine. I get this flu everywhere. And if you're going to stipulate that it went into the baby through the placenta and all that kind of, it should be both babies. I don't see what's magical about one. Anyway, that was her assessment of why she thought it was, and mind you, she thought it was a new infectious congenital problem. She didn't even think it was one of the old ones, of which there are theoretically many. If she says it's infectious, she could have picked toxoplasmosis, but apparently she tested for those things. She didn't find anything. So she assumed since it wasn't one of the torches, it had to be something new. And Carlos Brito came along and said, there's Zika, that's new. And then again, they had this mind meld about it. And then they're off to the races, if you know what that means. Then they thought everything starts to spiral way out of people's control. You know, it's easier to spill the milk than it is to put it back in the bottle.
Okay. I have to finish our meeting now.
Yes.
Because I have a lot of work to do this afternoon. I respect your opinion, of course. It's your opinion. But I have my idea about this disease. And this disease was caused by the congenital syndrome was caused by Zika virus. It's not just a microcephaly disease. It's a lot of malformations, bad formation in the babies. And it was important I think that we do not want a new outbreak in Brazil or other country in the world. But if you have a new outbreak, Zika outbreak, it's important for you to visit the doctors, the mothers, and especially the babies to see the babies with congenital disease. It's a severe disease, and it's a real disease, and we found the Zika virus. No other diagnosis for these babies. All the mothers developed the disease as so frequent. But if you know that you are a doctor, if the clinical diagnosis is done by the anamnesis and physical exam, this is how we can do the diagnosis of the people, not with lab tests. We use lab tests, but we do the dengue clinical diagnosis, chikungunya clinical diagnosis, and Zika clinical diagnosis. This was my experience during the Zika outbreak and congenital disease outbreak. I visit a lot of countries, visit Colombia, Panama, Guatemala, a lot of countries in Latin America, and I saw a lot of children with congenital Zika disease. Not just here, but we saw a lot of, I talked with the doctors in other countries. It's possible it's possible that everyone is wrong. It's possible. But it's possible that when the congenital disease was diagnosed,
I don't think they're wrong about seeing congenital problems. Okay, people see what they see. Congenital problem is an obvious thing. I don't disagree that people see that. The question is whether they're seeing more of that.
Yes, there's more. All the doctors here see more cases. All the doctors here know how to do the toxoplasmosis. They know. We live in a poor region of the country, but the doctors know how to do.
Oh, I don't dispute that.
We know how to do this.
I'm trusting their data now just like I trust their data before. I'm not disputing that people are
So
intelligent.
if the baby born with toxoplasmosis, the neonatologists know how to do this. To the have tests to do this.
I'm only using the data from Brazil. I haven't been to Brazil. Okay, I haven't seen these cases of microcephaly. I haven't seen a case of Zika. I'm using the data, both good that confirm my thoughts. So I'm using the data from 2015, from 2016 that Brazil produces. I'm only looking at what Brazil produces. I'm only formulating it based on the contradictions from the Brazilian data in, like I said, Paraíba, with the Brazilian data at the time. The fact of the matter is, during a crisis, people will make quicker, rash judgments.
I understand. But
anyway,
you are wrong. You are wrong. You are wrong.
All right.
You are wrong.
Well, I appreciate you being on. So I'm planning on putting this out as a YouTube video. I hope that people can determine the right and wrong part of it. I wish you luck. I'm happy to have you on again. I have a StreamYard, which is better for video. Would you do me the favor? Would you do me I'd really be honored if you would look at my book, though.
Okay. Send the name of the book, please, and I will buy. I will buy by Amazon.
And frankly, my wish and my dream would be to come down to Brazil and discuss this. I mean, obviously, I don't speak Portuguese. I don't speak Brazilian Portuguese, but I would love the opportunity to explain it. But you tell me if it makes sense first. We read it and go from there.
Okay. And where do you live in US?
I live in Boston.
In Boston? I will be in Boston.
For real?
In September. Yes.
Oh, really? Well, I'm happy to host you here.
Okay.
I'm happy to have you for dinner.
I will arrive in Boston in September 22. I will leave in Brazil in September 22. I think that September 23 I will be in Boston. So if possible, you can have a dinner.
Yeah, that'd be lovely. Give my regards to Carlos Brito and Rubio Suarez Campos and tell them I'd be happy to have a conversation with each of them.
Okay. I will say.
Thank you so much. Bye-bye.